this morning we're having a conversation with a breast cancer survivor, and she goes by the name JOYCELYN Yaokuma, and she is also a critical care nurse, and she's also the founder of the Sunflower Breast Cancer Support Group Ghana. And this morning we're having a conversation with regards to everything that she has been through. Good morning and welcome to the show, JOYCELYN.
Good morning to you and your viewers.
Are looking good.
Thank you, you too.
I mean, before we go much more into the breast cancer conversation, you are a critical care nurse.
Yes, please.
What's the difference between that and a normal nurse?
All right, so it's for general nursing. You go to school, do a 4-year, maybe degree program or diploma. So just in everything. Okay. So you are trained to nurse patient of any kind of disease. Okay. But then critical care nurses, they give experts specialized care to severely ill patients in the ICU. Okay. So patients with organ failure, such as respiratory failure, kidney failure, multiple organ failure, and all that. So we support the respiratory system by putting you on ventilator, or maybe going through dialysis. And this patient, they are very unstable. Okay. So because they are very unstable, there's a lot of care. They and need you need a lot of specialist knowledge to be able to nurse such patient. And we work with, like, it's a team. So we work with specialist doctors and anesthetists and all that. So
I wanted to know the difference.
Yes, so you need to complete the diploma or the degree before you go to school to go and train as a critical care nurse.
Okay. And how long have you been doing this?
Since 2017.
Wow, that's good. I hope it's been great. But in the course of this, that is when you realized you had breast cancer, or how did everything start?
So 2019 November, I went to work and came back. I got home around 9 p.m. And my husband is not Accra based, so we usually talk on phone. He will ask about the kids and all that. So we're talking on phone. I was lying on the bed on my back. So I think by chance, because I wasn't doing breast examination, I didn't go for October breast exam. The awareness was created, but because I thought I was fit and I was fine.
Yeah. And you're a nurse. If something is going on, you know.
Yes. I didn't go to check. I didn't have a family history too. So I felt the lump, like a hardening in my right breast. So I told him that I felt this hardening, like a lump in my breast. So he asked me to go and have a check. But when I got to work, I discussed with a few friends, and they were like, I just weaned my baby off breast milk in September. So it could be a blocked that or something. So, and most of them were like discouraged. And the lump was painless. You touch, you can press it, and you don't even feel anything. So I also just brushed it off. But he kept on asking always, have you checked?
As your husband kept asking, yeah.
So then I think a week or two before after that, I went to have it examined. And the doctor was like, the way it is, I needed to do a breast scan.
A breast scan.
So I did
not just the examination, but an image to see what it is.
Yes, because after he had examined it, he was saying that it looked defined and rounded and it was firm. So it's better to check further. So I did the breast scan the same day, and then I was told by the technician right there that it was cancer. Wow. Yes.
What was the first thing that ran through your head?
I think I went blank. Like, time stood still. Like, it was shocking. I was surprised. I mean, I was just confused.
How is this possible?
How is this possible? I mean, it was really
because you are fit.
Yes, and this lump was not painful.
Exactly.
So what happened?
All of a sudden.
All of a sudden.
Yeah.
So it was really hard. Driving back to work with the report in my hand was even. I can't tell you how I did that. So I got back and he was like, oh, even though the doctor said even though the scan says it's cancer, we can't confirm with that. So we need to go further and do a biopsy.
Okay.
So a tissue was taken from the lump, and then a pathologist have to examine it. So he did, and then the report came out after 3 weeks to say that, to confirm what...
Indeed, you have breast cancer.
Yes, there was breast cancer.
You said it, you see, most of the time we talk about examining the breast. You go to the hospital, the doctor or the nurse will just say, oh, raise your arm, do this, and they will check. Now, there is something I learned yesterday, that you can actually do a further scan. It gets the image. And now you went further to take a tissue out of the lump.
The lump, yes.
How was that done?
So it's done surgically. Either you go to theater and then they take a tissue out of the lump, or you do it under ultrasound guided. Okay. So so the ultrasound, it will visualize the breast and then the lump, so that they pick exactly the tissue they want. Okay. So that's what it's done. Okay. Then you will now take it to a pathologist to examine under a microscope.
We have to really take this breast cancer issue very seriously, because even stages to detect that you have is like a process. It's a process that you need to be sure that you have it. So now you've been diagnosed. What was the first step, or what did the doctors recommend that you do? Okay, so after the confirmation, I was counseled, and then the treatment explained to me. So the first step was surgery. So the surgery is in 2 forms. Either the breast is totally taken off, or the lump is removed. Before that, what stage did the doctor say you were on? At that moment, they couldn't say. It was after the surgery that it will determine which stage, because you need the lymph nodes and then the tissue, all the lump, to be able to determine the stages of the cancer. Okay. So the first stage, the first biopsy didn't state the stage. It just said, okay, so you are either hormone positive or hormone negative breast cancer patient. Okay, so I knew that I was hormone positive. That means that there were drugs that can actually kill these cancer cells. All right, so we did the surgery on the 10th of December 2019. And so I had 2 scars, one in my armpit where they remove lymph nodes, and then on my breast, there's a scar where the, like part of the breast tissue was taken with the lump. Okay. Yeah. So that happened, and then it has to go back to the pathologist again now for staging. Yeah. So it came back that I was first stage. First stage. Yes, please. And on the first stage, did the doctors say that you could take drugs to take it off, or they had to take the lump off? So with first stage, so at this stage, the lump has been taken. Okay. So the lump, so they take both the lump and healthy tissue. So it's like we call it wild excision. So it's just not the lump that is taken, but part of the breast tissues that are healthy. So they go like a distance away from the lump, and then see that, okay, we don't have cancer around here, and they take that part off. Okay. Yeah, that's what happens. So after that, you are staged. So after the staging, you know that, okay, so and so medication can, eradicate the rest of the cancer cells from your body. Yeah. So that is what happened. Were you in pain throughout this process? As in physical pain? Yeah, as in the pain in your breast, as in the lymph is causing pain, or what is the feeling? I want to know the feeling. Okay, so in my case, from the day I discovered this lump till I had surgery, there was no pain in my body. Okay. No pain at all, nothing. I could even, feel it, press it, and I wouldn't have any pain. It didn't give me any pain. It was just a normal lump in my breast. All right. So surgery definitely comes with pain. After surgery, there's a cut, and this time I had to with. I came back from theater with 2 wound drains. One in my armpit to drain whatever fluid or blood will come out, and then one in the wound in my breast. So it was taken out after, I think, 5 to 7 days. And then the next stage is chemotherapy. That's a lot. Yes. JOYCELYN, we've gone through a lot. We've gone through a lot. So through how many months or days or weeks did you spend with regards to chemo? About
4 months.
4 months. Okay.
Yeah.
Did you have
4 to 5 months?
4 to
yeah.
5. Did you have a long hair?
Started from January, ended in May.
Okay. And did you have long hair?
Yes, I had long hair, permed hair.
Okay.
But then I knew chemo. I was told, you know, chemo will affect your hair.
Yeah.
Your hair will fall off, your skin, your nails, your kidneys, your organs, your liver, and all that.
Yeah.
The drug has effect, like total effect on your total body.
Yeah.
Yes. So after the surgery, my husband was in this with me. So
at that time, he had come.
We talk on phone. So he was just in Kumasi. So Kumasi to Accra was.
It's not for us, so he just had to come.
So we discussed it, and then I took off the perm. So I cut it like it is now.
Now.
Yes. And then after, when I did the first chemo, it started falling off. So you sleep and wake up and your pillow is full of hair. Whilst you are bathing, it's falling off. By the time you finish bathing, the whole bath floor is full of hair.
It's like you
when you are
your
combing,
hair.
it's falling off. If you can just hold it and pull it out. You just hold and then it's like off. It comes off. Yes.
I don't want to sound
it's okay
biased and say that. How were you feeling emotionally?
Down, depressed. Yes, it was really difficult.
It's difficult because you didn't see this coming.
It's not something it's like cancer is bad news, and you know it kills.
Yeah. And
you don't even know whether you will respond to treatment or not.
Or beat it or be able to beat it completely.
Yes. So it's a whole of a lot of emotional trauma. The effect on even your family, those around you, your children and all that. It's a lot.
It's a lot.
Yes.
Yeah. So after chemo and everything, the breast wasn't taken off?
No, the breast wasn't taken. So I still have my breast, just I have a scar on it.
Yeah.
You know, that's where they went through to take the lump out.
So we can say that the 2 breasts are there, but then one had the cancer and they took it off.
Yes.
And you are surviving. And now the doctor said, is it gone completely? Or what did they say?
Okay, so, you know, for some cancers like lymphoma, they can say you are in remission. But then with breast cancer, we don't use the term remission.
Remission, yeah.
Yes, it's just that maybe you are something like cancer-free or something.
Okay,
or no evidence of disease. So the mammograms, the scan, and all other things will come out that there's no evidence of disease in your body.
Yeah.
Okay, so that's the term we use for cancer.
Okay.
Yeah. So currently, I don't have evidence of breast cancer.
Okay.
But then the bad news is that the risk of it coming back is high.
What's the probability?
For a breast cancer patient, the probability that, so let me say 50%.
Actually, don't say that.
No, but not for all.
Not for all patients. Okay.
Yes.
Okay.
So that depends on taking care of yourself.
Yes. And talking of taking care of yourself, what did the doctors advise you do moving forward?
So basically, with the risks for breast cancer, we know alcohol, smoking, obesity. There are
unhealthy lifestyle.
Yes.
Yeah.
So you need to cut down on that or stop. Then you need to exercise.
Okay.
Yes. So those are the advices. Yeah. So,
but it didn't affect your food, maybe taking pepper, salt, or sugar.
During chemo, you have bitterness in your mouth, or you don't have the good taste. So eating was a problem. Okay. But you need to eat to get the strength.
Yeah, exactly.
So nobody will limit you to don't eat sugar, don't eat that. But putting food in your mouth, it's like you don't even have taste.
Yeah. So why eat? And then you need the food.
But you need the food for strength, so you need to force and eat.
Is it after you went through the process? Is it that made you found your foundation, as in the Sunflower Breast Cancer Group? Is it a foundation or just a group?
It's like a group.
It's a group.
So the motive was to inspire others, to encourage others. It's lonely. It was a lonely path. I realized,
even though you had your husband.
yes, you know, he is a banker. My mom is a businesswoman. I'm the nurse.
Yeah.
But even with that, our knowledge about the whole, I've nursed cancer patients, but you know, to get involved, to actually experience it, and then getting someone to even talk to, someone who has walked the path to tell you that, oh, it's what you are feeling, it's normal, and that you'll be fine.
You'll be fine.
It wasn't there. Okay. So that's why I said it was a lonely path.
Oh, okay.
So then I decided that no, I don't think any woman should go through this alone, because psychologically it affects you. Yeah. So then I wanted to come out and then encourage other women going through this cancer treatment. It's nice to meet someone and tell, oh, I went through the treatment. Look at me, I'm better. To just encourage you that you can fight it, because sometimes you can lose the will to live. And that is very dangerous. So that encouraged me to come out with this group, Sunflower Breast Cancer Support Group, so that we educate. I have friends that support me. We go to churches, you call us, we'll come and do screening, we'll educate you. Then for the patient, my number is out there. Some will ask, so after surgery, what do we do? You know, some will need bookings, appointments, and all that. So we do. The
group assist with all that.
Yes, please.
You are doing a very marvelous, incredible job.
Thank you.
And I must
to the glory of God.
Yes, I must commend you for that. But ever since you started this group, how have people joined? Has the numbers increased over the period? How has it been? All
right. So I started with just a few friends, and then people. So mostly. We are called in October. October, everybody wants to have breast examination or breast cancer awareness. So, yes, we get people calling us to do all the screening and all that. And for the patients I navigate or I talk to, yes, I've had good comments. People call me and say, thank you. You were the reason why I was able to go through it. And it's fulfilling. That, like, even Saturday, one called me, was like, you know, it took you for me to go through this. I said, it took the grace of God. It's not me. He said, yes. If you weren't there, like, I would have given up and all that. Some will tell you that, oh, I had even started, you know, preparing my will, telling my children, I owe this person, this person owes me, or those kind of things. But then, after you've come in to talk and encourage us, we knew that we could make it. And then,
there's hope.
There's hope, hope. So I just wanted to be a symbol of hope to everyone.
People. JOYCELYN, if anybody is watching and wants to get in touch with you, your social media,
all right,
so they can get in touch with you.
My number is 0243644912 or 0208393580. And then I'm on Facebook as JOYCELYN YAOKUMAH. I'm also on TikTok, Sunflower Breast Cancer Support Group. So.
Thank you very much, JOYCELYN, for coming in to tell us your story and inspire us and give us the hope that even though you are diagnosed,
it's not a life, it's not a death sentence.
A death sentence. I wanted to say that
it's
not a
death sentence.
Yeah, thank you very much for the dedication this morning.
Thank you.